These white patches clouding the lungs are a hallmark of untreated tuberculosis, a sign that a patient's immune system is destroyed by HIV. In the Mission Hospital in Mpongwe, these X-rays are no longer rare. Doctors are saving them to show medical students disease they haven't seen in decades. In January and February of this year, this single hospital saw 28 new cases of advanced AIDS each month. A year ago, that number was closer to 1. This spike reverses progress that began in 2003. That year, the Bush administration launched PEPFAR, a massive U.S. aid program that built laboratories and clinics, eventually doubling Zambia's national life expectancy. That support shifted in early 2025. The Trump administration slashed the funding, local health organizations closed their doors, and thousands of workers who managed the daily operations of the HIV program lost their jobs. These are bottles of antiretroviral medication, or ARVs. Despite the loss of staff and funding, the Zambian government successfully managed the supply chain, ensuring these pills reached nearly all of the 1.3 million people who rely on them. Having medication on the shelf cannot prevent a hospital from filling with dying patients if the system required to identify and monitor the people who need it has been dismantled. A public health system is more than a pharmacy. It relies on an invisible web of proactive disease tracking. In Zambia, the funding for that web has disappeared. This map illustrates how scientists once hunted the virus. Genetic sequencing revealed hot zones of fresh infections along trucking routes. Index testing traced contacts, identifying 70% of new infections. Today, with funding cut, unmonitored networks leave patients disconnected. Without these macro-level tracking mechanisms, the virus spreads through the population entirely undetected. The country's epidemiologists are now working in the dark. The breakdown continues at local centers like the Pendo Medical Clinic, where the loss of basic administrative infrastructure causes fatal delays for individual patients. Because U.S. aid groups owned and operated the digital records, the fired data clerks often took the database passwords with them. Local nurses and clinicians found themselves locked out of their own patient files. This is a return to paper records. Without digital alerts, charts are stacked into teetering piles on desks, and clinicians have no automated way to catch a critical blood test result before it's buried in a box. Precious Malenga's blood test showed a dangerously high viral load last July. But because the digital alert system was gone and there was no community health worker to find her, she didn't hear the results for 7 months. By then, she was already pregnant. The danger extends to the next generation. The expensive genetic tests that once diagnosed newborns at birth have been replaced by a cheaper blood test that requires a 6-week wait, a period in which many transient families move on and the child's status remains unknown. When micro-level tracking fails, a manageable infection can once again become a lifelong burden, often passed to children who will not be diagnosed until they are repeatedly hospitalized. Today's rise in local infections will not appear in Zambia's official data for years. We will see the impact only when these patients arrive at hospitals with compromised immune systems, having unknowingly spread the virus in the meantime. This worker is overlooking a copper mine, part of the mineral wealth that has become a pivot point in the crisis. The U.S. provided bridge funding to keep the HIV program alive, but attached an April 30th deadline. Zambia must sign a deal giving the U.S. expanded access to these resources. The threat is direct. If the Zambian government refuses to sign over these rights, the State Department warns it will cut off all remaining assistance for the HIV program. This ultimatum reveals the vulnerability created by 2 decades of aid. Zambia allowed a foreign power to maintain control of everything from the supply chains to the digital passwords, never fully taking over the operations of its own survival. When a nation outsources its healthcare infrastructure to a foreign superpower, medicine becomes a geopolitical bargaining chip, and the cost of the next negotiation is measured in human lives.